Fellow Ugandans, ladies and gentlemen, I have been asked to speak a bit more about the coronavirus crisis. One, the people wanted to know what they can do. And secondly, to highlight some of the ongoing injustices and really criminal acts of dictator Museveni and his henchmen. As all of you know, he has decreed that everybody should put on face masks. This would be okay, and I'm a medical doctor, and I support the use of masks. In fact, I've been advocating masks right from the word go, even before the WHO did. However, it is very unfair to ask people to put on masks that are not there, and then reject their homemade masks as not acceptable. People should be able to make their own masks from home. One, because the government has failed to supply the masks. And even when it supplies, they're expensive. And we're not even sure that they're actually healthy, because it has a track record of poisoning, of contaminating things that are given out to the public. So he might actually contaminate these masks for the public. He has done it before with mosquito nets, so he can do it again. I saw a video, people being beaten, being kicked because they're not putting on masks. And the government is not supplying the masks. There are no outlets to buy these masks. They are not available freely. In fact, they should be given out freely because the government has borrowed so much money. However, at the same time, the government is exporting masks and sanitizer made in Uganda. There are now 3 factories in Uganda. The latest, maybe as you might know, is the one under Mbabazi, the former prime minister. And the government has extended billions of shillings to this factory to make masks. Where are they? However, if you go to London, and if you go to a few other places, you'll be able to see masks and sanitizers made in Uganda, when the local population do not have the sanitizer, do not have the masks. And the dictator Museveni is not ashamed to send his henchmen, his goons, to beat up the public because they're not putting on masks. This is not acceptable, Ugandans. This is the time for Ugandans to rise up and say, no, enough is enough. How far is this man going to go? How far are we going to tolerate such impunity? Ladies and gentlemen, some people have been asking me to repeat my initial advice I gave 4 weeks ago about what to do if somebody suspects or he's not feeling well, but suspect he may be getting corona, but just not feeling well. He doesn't want to get corona anyway. Yes, there are a few other things that you can do. These are simple, but very effective. I would like you to get oranges. You cut them into pieces. Onions, cut them in pieces. Lemon, you cut them in pieces. Garlic, ginger, again, cut them in pieces. Potatoes, and a few other things, a few other herbs, which you may have locally, which you may not have. For example, in Uganda, it's called a rukandwa and a chigaji. Put this together and boil. You boil until you get that steam coming out. you cover yourself over, and the steam is going to heat you up, go through your nostrils, and you have a very good sweat. This should be for at least a minimum of 10 minutes, if you can take it. But sometimes the steam is very hot and you may not be able to survive 10 minutes. 5 is okay, but 10 minutes will be okay, 10 to 15 if you can. You find at the end you'll be sweating and your nose will be dripping. Do this twice a week. In addition, there are certain common sense things that you need to do. Wash your hands. I'll say that again. Wash your hands. And the third time, wash your hands at every opportunity with soap and water. In reality, you don't need sanitizers if you've got soap and water. In fact, it might be more hygienic. Eat lots of food and fruit with vitamin C, vitamin E, and vitamin D. Spend at least half an hour in the sun. Keep active and do lots of exercises. You don't have to go to the gym. Don't spend that money. What for? Get a hoe and go to your garden and dig. 1, you'll be getting the exercise. 2, you'll be getting the sun. 3, you'll be getting food. So it's 3 for the price of 1. One thing I didn't mention in my Uganda presentation, avoid shaking hands. Please, you don't have to shake hands, not at this time anyway. So avoid shaking hands. These few but very simple actions are going to go a long way in protecting you and also increasing your resistance, to boost your resistance against infection. And do this daily. Don't forget. It's very useful. Now, coming back to the general topic, I would like again to call upon the government to explain to the people where the money that has been donated has gone. And I'm going to show a video where the American embassy stated they've given money to the government to help people who are in dire need. This has not happened. And the people being taken to so-called isolation centers are suffering. They sleep badly, they eat badly. And what is more worrying is they're being injected, but drugs that are not known to them. And if they ask questions, they don't get answers. There is a rumor, and as I say, it's a rumor, but we must investigate that the government is collaborating with some people to use Ugandans as guinea pigs by giving them injections. If this is true, this is murder, this is criminal, and must be stopped immediately. So I would like the government to come clean and tell us what they are injecting these people. What are they injecting into these people when they take them to the isolation centers? And I'm not going to leave this. I'm going to push and push until we get answers or until we get a change of government. Ladies and gentlemen, I'd like you to join me to bring sanity, to bring peace, to bring pride into our lives and Ugandans at large by changing this government, by booting the government of dictator Yoweri Museveni from power so that we can regain our country and motherland. May the Lord bless you for God and my country.
Hello, I'm Christopher Kraft, the head of the U.S. mission in Uganda. 2 days ago, Secretary of State Pompeo announced that the American people made a commitment of an additional $162 million for the global COVID-19 response, bringing the total to date to more than $1 billion since the outbreak began. Here in Uganda, we've already contributed more than $15 million, or 56 billion Ugandan shillings, to the COVID-19 response. For decades, the U.S. mission has invested in Uganda's health sector, including systems strengthening and preventing, detecting, and responding to infectious diseases. The fact that the government of Uganda's health system was well prepared to respond to COVID-19 was in large part due to years of close partnership between the United States and Uganda, along with U.S. government investment and support. In addition to our long-term support to combat infectious diseases in Uganda, the United States provided technical assistance and support to the Ugandan government for prevention and preparedness before a single case of COVID-19 arrived in Uganda. And as soon as cases began to cross Uganda's borders, we responded with additional support. So where does our financial assistance go? It is supporting the salaries of additional personnel, as well as critical equipment. It is helping to upgrade health centers with electronic data systems across the nation. And it is expanding laboratory capacity so that more testing can be done. We are assisting with the evaluation of new COVID-19 test kits, disseminating risk communications so that ordinary Ugandans get the information they need to stay safe, and supporting border screening to help identify positive cases before they enter the country, just to name a few examples. We've also directed funding to HIV services to ensure the safety of clients and health workers through training and updated standard operating procedures to address COVID-19. And we've contributed funding to enhance child protection, to support refugees and their host communities, and to monitor human rights abuses occurring as a result of the pandemic. The U.S. mission in Uganda has always looked at our partnership with the Ugandan people with the bigger picture in mind. Not only have we spread our assistance across many parts of the health sector, but we're also working with the Ugandan government and other development partners to support the Ugandan people, businesses, and institutions as they deal with the economic fallout of COVID-19. Today, I am pleased to announce that in addition to our $15 million in recent contributions, the U.S. Agency for International Development awarded an additional $10 million this week through the organization Give Directly. This will be used for cash transfers supporting tens of thousands of vulnerable Ugandans. This significant U.S. government contribution will help provide direct cash grants of $25 a month per adult in the most affected communities over a period of 3 months. As many people are reduced to eating meager rations and face the threat of starvation due to the impact of COVID-19 and necessary restrictions, the monthly cash grant will help them meet their basic needs. We're in this together, hand in hand with Uganda, like we have been for decades. And we are committed to continuing the hard work and support that is needed to fight this disease. I am confident that together we will succeed. Thank you.